Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. If that is something that you are interested in, please make sure to subscribe now, hit the notification bell so that you will be notified every time I upload a videos. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, you guys, let's jump into the video. How are you guys, everybody? How are you doing today? Now, I would just like to say, wherever you are right now, whatever time zone you're watching me right now, just wish you good morning, good afternoon, and good night, just in case I don't get to see you. Medyo nahuli nga po yung pag-upload natin for today, pero sisikapin ko dito sa time zone ko, kung nasaan man ako, is pasok pa rin to sa entry natin for Monday. Kasi every Monday and Wednesdays and Fridays nga po ako nag-upload. I was a little bit busy lately. So this couple of days I've been really struggling with my time. I feel like there's been a lot of things happening to me. I mean, like in my professional life and personally speaking, but I'm still gonna commit on you guys. I'm still gonna fulfill and try to do my promise to you that I'm gonna upload a video every Monday, Wednesday, and Friday. So here it is. Now, if you haven't checked out the last week's upload that I created for you, please make sure to check the one out because 3 times a week nga po tayo nag-upload. Ngayon, gusto ko lang pong i-announce sa inyong lahat na I will be launching my Spotify account, not Spotify, but you'll be hearing my podcast on Spotify. So it's all about mental health. It's all about spirituality, soul, being, living your highest and truest potential as a human being. Wow, diba? So yun lang po. Pero hindi ko na patatagalin pa kasi alam ko napakarami ang excited dito. Wait lang. Grabe nga pong response nyo whenever, every time, actually sa lahat naman ng videos ko, pero specifically kapag nag-upload ako ng nursing test banking video, I know how important it is. And I actually know how this is very helpful sa lahat ng mga upcoming test takers natin dyan. Sa board exam natin sa Pilipinas, PNLE. Hindi lang sa PNLE, pati na rin sa NCLEX, CBT, OSCE, DHA, PROMETRIC, all of those licensure examinations that we have kasi this is your preparation for your actual examination that you're going to be taking anytime soon. So, let this be your nursing study guide. Ngayon, kung hindi mo pa napapanood yung other nursing test banking videos I created for you, I have a lot of them. Please make sure that you check out the description box because I'll be putting the actual playlist link there, or whenever the icon button pops out anytime on this video, click the one out because that is all for you. I'll be putting the links to some of the playlists I have on my channel. Ngayon, kagaya na nakita mo sa title, this is going to be Foundation of Professional Nursing Practice, another entry natin sa Nursing Test Bank, PNLE 1. Diba? Ang saya-saya, exciting. Hindi ko na patatagalin pa, medyo mahaba itong video na to. Let's proceed. Now, let me share to you our objectives for today. Every time that we do a nursing test banking video, there's only 2 objectives or purpose or intention. One is I'm going to provide you and discuss to you board exam type of questions na maaaring lumabas ngayong darating ng board exam. All right. Next, I am going to provide rationalization for each board exam type of questions. Now, if there's anything that I want you to take out from this video, that is the rationalization because it doesn't matter how high your score is for now. Of course, we're aiming for a high score, but that's your goal on the actual board exam. But for now, I just want you to take this time to really, alam mo yun, lasapin mo yung rationalization para kahit pag ikot-ikutin yung tanong, baguhin nila yung scenario, baguhin nila yung settings ng tanong or kung ano man, you know exactly why that is the right answer because you know by heart that other reason behind why is that the right answer because you know the rationalization. All right? Okay. So let me share to you our instructions for today's video. You'll be given 10 board exam type of questions. I'll be reading the questions and the choices for you. You have 5 seconds to answer each question. The answer is revealed instantly after each question with rationalization. Choose the letter of the correct answer. Good luck, nurses. Alright, take this exam as if you are actually sitting down. I-visualize mo na. You're being actually sitting down the actual board. If this is the last 10 board questions, the PNLE one, you wanna nail this. You know what I mean? You wanna get this right. Okay, so mindset mo na, i-mindset mo na, i-manifest mo na. Magsisimula na tayo with our very first question for today. Board exam type of question number 1. The physician orders the administration of high humidity oxygen by face mask and placement of the patient in high Fowler's position. After assessing Mrs. Paul, the nurse writes the following nursing diagnosis. Impaired gas exchange related to increased secretions. Which of the following nursing interventions has the greatest potential for improving this situation? Anong nursing intervention? Tinatanong ka, nursing action. That is the question. That is related to what? Related to patient on oxygen. High oxygen therapy. Is it A, encourage the patient to increase her fluid intake to 200 ml every 2 hours? B, place a humidifier in the patient's room. C, continue administering oxygen by high humidity face mask. Or D, perform chest physiotherapy on a regular schedule. Your 5 seconds starts now. Time's up, you guys. What is your answer? Very good. The answer is letter A. Encourage the patient to increase her fluid intake to 200 ml every 2 hours. Now, here's the rationalization. Here's why. A nga po ang tamang sagot because adequate hydration thins and loosens pulmonary secretions and also helps to replace fluid lost from elevated temperature, diaphoresis, and dehydration and dyspnea. High humidity air and chest physiotherapy help liquefy and mobilize secretions. That is why the answer is letter A. Next, board exam type of question number 2. The most common deficiency seen in alcoholics. Anong deficiency ang makikita mo sa mga alcoholics? Very specific itong tanong na to, very direct forward. Anong tanong sa mga chronic alcoholics ang makikita mo? Anong tanong? Anong deficiency sa mga chronic alcoholics ang kadalasang nagiging result due to prolonged or long time being alcoholic? Is it A, thiamine? Is it B, riboflavin? Is it C, pyridoxine? Or D, pantothenic acid? Your 5 seconds starts now. Time's up, you guys. What is the answer? Very good. Thiamine. That is the right answer. Vitamin B1. A chronic alcoholism commonly results in thiamine deficiency and other symptoms of malnutrition. Period. Malinaw ba yon? Malinaw. Board exam type of question number 3. Which of the following statement is incorrect about a patient with dysphagia? What is dysphagia? Difficulty of swallowing. Incorrect. Negative statement ito about dysphagia. Alright, nagets yung tanong? Nuggets. Basahin ko lang yung choices. Is it A, the patient will find pureed or soft foods such as custard easier to swallow than water? Is it B, Fowler's or semi-Fowler's position reduces the risk of aspiration during swallowing? C, the patient should always feed himself. Or D, the nurse should perform oral hygiene before assisting with feeding. Your 5 seconds starts now. Time's up, you guys. What is the answer? Very good. The answer to this one is letter C. The patient should always feed himself. All right, why? A patient with dysphagia or difficulty of swallowing requires assistance with feeding. Feeding himself is a long-range expected outcome. Soft food, Fowler's or semi-Fowler's position, and oral hygiene before eating should be part of the feeding regimen. Hence, the negative statement, the negative answer is the one that you would choose. Careful kayo sa pag mga ganitong klaseng tanong, yung mga negative question. Yes, kasi madalas ito, very tricky. You know how to spot it and you know how to attack these types of questions. All right? Okay, let's proceed. Board exam type of question number 4. To assess the kidney function of a patient with an indwelling urinary Foley catheter, the nurse measures his hourly urine output. She should notify the physician if the urine output is, ito yung sitwasyon, naka-Foley's ang pasyente mo. Tinatanong ka, kailan mo ino-notify yung physician mo? Kapag ang urine output mo ay anong range? Normal values. That's the question. What is the normal urine value? That's the question. Disregard the Foley's catheter. Disregard that. But if you know the normal urine output per hour, you'll be able to answer this question. Is it A, less than 30 ml per hour? Is it B, 64 ml in 2 hours? Is it C, 90 ml in 3 hours? Or D, 125 ml in 4 hours? Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. Letter A, less than 30 ml per hour. Why? A urine output of less than 30 ml per hour indicates hypovolemia or oliguria, decrease urination, which is related to kidney function and inadequate fluid intake. What is your normal urine output? 20 ml per hour. That is equivalent to, calculator tayo, 30 ml times 24 hours. So that is 720 ml in 24 hour in one day. So, kaya yung mga pasyente nag-urine na INO monitoring, importante na ilalagay mo yung urine output mo. By the end of your shift, ina-update mo yon, or every now and then ina-update yon. Alright? Lalo na sa mga CKD patients. That's very important. Proceed na tayo. Nangangalahati na nga po tayo, excuse me. Kumusta mga score nyo? Maganda ba? Maganda ang dating? Very good. Now, question number 5. Certain substances increase the amount of urine produced. These include, tinatanong ka, alin sa mga food group na ito ang ang tumutulong to increase the amount of urine output. Okay? Malinaw yon? Malinaw. So, sagutin na natin. Sagutin. Basahin ko na sa inyo yung mga choices. A, caffeine-containing drinks such as coffee and cola. B, beets. C, urinary analgesics. Food. Certain substances. Or D, kaolin and pectin. Kaopectate. Your 5 seconds starts now. Time is up. What is the answer? Very good, nurses. The answer is letter A. Caffeine-containing drinks such as coffee and cola. Why? Listen, fluids containing caffeine have a diuretic effect. Beets and urinary analgesics such as pyridium can color urine red. Kaopectic or kaopectate is an anti-diarrheal medication. Period. Proceed. Board exam type question number 6. A male patient who had surgery 2 days ago for head and neck cancer is about to make his first attempt to ambulate outside his room. The nurse notes that he is steady on his feet and that his vision was unaffected by the surgery. Which of the following nursing action would be appropriate? Appropriate nursing intervention sa pasyenteng gustong mag-ambulate post-op 2 days ng head and neck surgery. Is it A, encourage the patient to walk in the hall alone? B. Discourage the patient from walking in the hall for a few more days. C. Accompany the patient for his walk. Or D. Consult a physician. I'm sorry, typographical error. Consult a physician, a physical therapist before allowing the patient to ambulate. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. You got this one right. Letter C. Kung hindi mo naman nakuha ang tamang sagot dito, i-explain ko sa iyo bakit. Here's the rationale, you guys. Listen. C nga po ang tamang sagot because a hospitalized surgical patient leaving his room for the first time fears rejection and others staring at him. So, he should not walk alone. Accompanying him will offer moral support, enabling him to face the rest of the world. Patients should begin ambulation as soon as possible after surgery to decrease complications and to regain strength and confidence. Waiting to consult a physical therapist is unnecessary. Alright, so hindi necessary yung physical therapy referral unless is direct order by the doctor. But, di ba yung mga nagpo-post up sa atin, early ambulation ang ating ini-instruct agad-agad. Depende kapag as tolerated ng pasyente and as ordered or depende sa klase ng surgery na ginawa. Pero mostly, ang ginagawa natin early ambulation, what? Why? Because we want to prevent, we want to increase the blood circulation, especially doon sa surgical site, and we want to prevent blood clots formation. All right? We don't want to develop any PE or any thrombosis and those ugly stuff. All right? All right, so next, board exam type of question number 7. A patient has exacerbation of chronic obstructive pulmonary disease, or we all know as COPD, manifested by shortness of breath, orthopnea, thick tenacious secretions, and a dry hacking cough. An appropriate nursing diagnosis would be, tinatanong ka, nako, very nanda ito. Anong nursing diagnosis mo kung binigyan ka ng ganitong klaseng clinical manifestation? COPD, may SOB, may orthopnea, merong secretions, and dry hacking cough. Okay. Is it A, ineffective airway clearance related to thick, tenacious secretions? Is it B, ineffective airway clearance related to dry hacking cough? Or C, ineffective individual coping to COPD? Or D, pain related to immobilization of affected leg. Pag sinagot mo ang D, na wala namang binanggit na may pain at sinabi namang leg, ay talaga namang makakatikim ka. Your 5 seconds starts now. Time is up, you guys. What is the answer? Very good. I got you guys. Letter A. Ineffective airway clearance related to thick, tenacious secretions. Why? Thick, tenacious secretions, a dry, hacking cough, orthopnea, and shortness of breath are signs of ineffective airway clearance. Ineffective airway clearance, you guys, related to dry, hacking cough is incorrect because the cough is not the reason for the ineffective airway clearance. Again, the cough is not the reason. Ineffective individual coping related to COPD is wrong because the etiology for a nursing diagnosis should not be a medical diagnosis or COPD. Naalala mo yung etiology? Pag nagpo-formulate tayo ng nursing diagnosis, it should not be any medical term, any medical condition and stuff. And because no data indicate that the patient is coping ineffectively, pain related to immobilization of affected leg would be an appropriate nursing diagnosis for a patient with a leg fracture. Appropriate for a patient with leg fracture. Alright? Hence, the answer to this one is letter A. Proceed na tayo. Last 3 questions. Mrs. Lim begins to cry as the nurse discusses her hair loss. The best response would be, nako, very emotional nursing. Wow. Very psychiatric nursing. Wow. A very body image-like question. Alright? Anong response mo kapag nagdi-discuss yung pasyente na nag-open ng topic yung pasyente mo about hair loss? Tapos biglang umiyak yung pasyente mo. Are you gonna A, don't worry, it's only temporary? Okay? Is it B, why are you crying? I didn't get to do that. I didn't get to the bad news yet. Wow! Iba naman talaga. C, your hair is really pretty. Or D, I know this will be difficult for you, but your hair will grow back after the completion of chemotherapy. Your 5 seconds starts now. Okay. 'Di ba? Very therapeutic communication ang atake ng tanong na ito. Ang tamang sagot is letter D. Hi. First of all, you're not gonna answer A. That's reassurance. You don't provide false hope. Hindi ka Diyos. Joke. Isa kang nurse. Char. Okay, here's the answer. Letter D nga po. I know this will be difficult for you, but your hair will grow back after the completion of chemotherapy. Oh my God, there's the dog barking. Okay? I'm sorry for the noise. Okay, D. Why? Because I know this will be difficult, acknowledges the problem and suggests a resolution to it. Don't worry, offers some relief, but doesn't recognize the patient's feelings. I didn't get to the bad news yet would be inappropriate at any time. Your hair is really pretty. Offers no consolation or alternatives to the patient. That is the rationale. Okay? Next, board exam type of question number 9. An additional vitamin C is required during all of the following periods except, negative question na naman to, kailan hindi kailangan ng additional vitamin C? That is the question. Is it A, infancy? Is it B, young adulthood? Is it C, childhood? Or D, pregnancy? Kailan hindi kailangan ng additional vitamin C? Anong period sa buhay ng isang tao o isang pasyente? Your 5 seconds starts now. Time is up. The answer is letter. Very good. B. Young adulthood. Now, additional vitamin C is needed in growth periods such as infancy and childhood and during pregnancy to supply demands for fetal growth and maternal tissues. Other conditions requiring extra vitamin C include wound healing, fever, infection, and stress. So, sa mga stress dyan, hindi ko alam kung saan sa buhay mo, mag-vitamin C ka, additional. So, kung nagtitake ka ng 1,000 mg per day, gawin mong 1.5. Ganun. Okay, last question na nga tayo for today's video. Bago ko nga po i-reveal, gusto ko lang magpasalamat ulit sa patuloy niyong pagsuporta sa channel ko. Maraming salamat po from the bottom of my heart. You guys are amazing and we're on our journey to 17,000. And I know that number is not really the main intention why we're doing or while I started this channel. Of course, I want to be, known as the number one nurse online educator, but nakakataba lang ng puso na nare-receive ko yung mga support niya. Maraming salamat po. Diba? Last questions. Board exam type of question number 10. A prescribed amount of oxygen is needed for a patient with COPD to prevent. So, bakit ka nagbibigay ng oxygen sa pasyenteng COPD? Anong pine-prevent mo? Is it A, cardiac arrest related to increased partial pressure of carbon dioxide in arterial blood? Is it B, circulatory overload due to hypervolemia, respiratory excitement? Or D, inhibition of the respiratory hypoxic stimulus? Your 5 seconds starts now. Alright, so let me give you the rationale. The answer to this one, you guys, is letter. Change ko lang yung pen ko. Cursor ko. Letter D, inhibition of respiratory hypoxic stimulus. Here's the rationale. Delivery of more than 2 liters of oxygen per minute to a patient with chronic obstructive pulmonary disease or COPD who is usually in a state of compensated respiratory acidosis, retaining carbon dioxide or CO2 can inhibit the hypoxic stimulus for respiration. Now, an increased partial pressure of carbon dioxide in arterial blood o yung ating PCO2 would not initially result in cardiac arrest. Circulatory overload and respiratory excitement have no relevance to the question. Di ba naalala mo pag COPD, tinatanong mo yung history COPD ang pasyente mo na admit. Tapos nag-SOP. Normally, meron lang yung target O2 saturation level. It's either 92 to 94%. Depende sa order ng doktor. Pwede silang hindi mag-exceed doon. So, I mean, pwedeng within that range lang yung O2 sat nila. Hindi pwedeng acceptable value yung O2 sat nila within that within that range. Depende yung sa order 92 or 94 O2 saturation. Ang oxygen mo dapat, you guys, ay hindi lalagpas doon, hindi tataas to the point na mag-exceed ka doon sa iyong O2 saturation target. Diba? Because the risk nga po is hypoxic stimulus. Magkakaroon ng retention ng CO2 ang pasyente mo kapag nagkaganoon. And you don't want that. Okay? Kasi that could lead to what? That could lead to respiratory acidosis. Alright? Thank you so much you guys for watching. Hope you learned something. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Please, please, please. Also, I would like to ask for the scores of my students. Put it down on the comment section below. No shame, no shame. Pinaghirapan mo yan. Please like, share nga po ang video na to. Tulungan mo na nga ako ipamalita sa Radyong Sira, ang pinakabago, pinaka-fresh at ang pinakalibreng nursing review center sa balat ng YouTube. And I'll see you again next week. Bago pang lahat, bago ko tuluyan tapusin to, don't forget to follow me on all my other social media accounts. Everything nga po is under Neil Galve, except for my TikTok account, which is Neil Galve Official. And I would also like to invite you to please follow me on my Facebook page. It's Neil Galve. The links to all my social media social media accounts is on the description box. I'll see you again on Wednesday. You have a good one.